Hi everyone, welcome to my live session. I'm Dr.RakheeYadav, consultant pediatrician. Today's topic is child development, something a little bit different, and how we have, during the lockdown, made the unseen seen. So it's a little bit different topic compared to our usual COVID-19, and I have with me a clinical psychologist, Dr. Dhanya Pillai, who will be joining us. Let me just see if I can add Dr. Dhanya into the room. Just give me a minute. Right. Yeah. Okay. Hello.
Hello.
You hear me clearly? Is everything okay?
Yes, clear.
All right. Welcome. Thank you so much. Welcome to my live session. I'm so grateful that you're doing this with me. And I know we've postponed this a couple of times, but I'm so grateful that we're actually able to do, because this topic has been something that's been bugging me for quite a while, especially since the beginning of the pandemic. I've had a lot of parents that come in and tell me they're suddenly noticing things with their children. They're suddenly seeing certain developments that are abnormal. And I thought it would be really good for us to also touch a little bit about mental health in children. So thank you so much, Dr. Dhanya. Would you like to tell us a little bit about yourself and how you got to who you are?
Okay, just a quick one. I'm a clinical psychologist, and I've been practicing for about 10 years now. And I primarily work with children and teenagers. And I really enjoy working with that population.
Absolutely. And I always refer all my patients to you. So it's been a pleasure working with you in these past few years as well. And let's go straight into it. Would you like to tell us a little bit about normal child development? What is normal child development?
Okay, well, child development is basically the full scope of skills that a child would sort of master over their lifespan, in the beginning stages, right? So it would cover basic things like their cognition, so their ability to think, learn, problem solve, rationalize, right? As well as things like social interaction, their emotional regulation skills, physical skills, speech, language, and communication skills. So these are all areas of development that you would look at when we talk about children's growth, right? So one thing that we have to remember is, I'm sure you've heard people saying things like, check their developmental milestones, right? So when we talk about that, we're looking at a child's development and in the context of their milestones, right? So we want to make sure that roughly when we talk about milestones, we're talking about a rough gauge of at what age a child should sort of hit a certain point of being able to do something, right? So again, every child is unique. They develop at different times, but as a guideline, we kind of want to benchmark certain steps, certain areas, right? And the importance of that is so that we can pick up if there's any delays in certain areas, because we know that it's extremely important to intervene early, right? The earlier we intervene, early intervention is just really important, because you see the child developing a lot quicker when we intervene early. So looking at these things at an early stage gives us the opportunity to kind of identify the gaps in growth and for us to kind of bridge the gap. So that's why we always encourage parents to, hey, look into these things as well. And obviously pediatricians, their first port of call would be able to give them first kind of like inclination to what you should be looking for, when they go for their regular checkups, when they go for their vaccinations, right? Yeah.
Absolutely. So I think it's part and parcel of any child who comes in to see their doctor, whether it's a pediatrician, whether it's their general physician, their GP, whichever doctor that they're seeing, every checkup that they go from birth until at least the first few years of life, we usually monitor their development. And if there's anything that we see that abnormal, is delayed, or starting to give a little bit of a red flag, we always stop the person right there, and we look into it and we monitor them a little bit more closely, because we want early intervention, like you mentioned. And I'd also like to stress to parents out there the fact that development is not a one-figure thing. So it's not like, okay, 1 year old, you're going to walk. 18 months, you're going to talk. No, it's not like that. It goes into phases, and we actually give a range as well. So if you can walk at 8 months, 9 months, fantastic, you're good. But if you can walk at 11 months, you're still normal. If you walk at 18 months, you're still normal. So there is a range for normal development in every aspect of all that you have mentioned. So various things that we look into, and if we find anything abnormal, that's when we get a developmental doctor or a pediatrician or a child psychologist to look into those aspects and see if there's anything wrong, or are we just being overly cautious. So it's always better to err on the side of caution if you're going to pick up something early. Excellent. So thank you so much for that explanation. What about the type of cases that are being picked up now, especially during the lockdown? So we know kids are at home longer than usual. We know we've got all these online classes and all. What are the types of cases that you're seeing on a rise in the past 1.5 years?
Well, from my experience, because parents are spending a lot more time at home, working from home and all, and they're spending a lot more time with their children. So not so much picking up diagnosable problems per se, but they're picking up on little difficulties that maybe they didn't recognize before, or they didn't have the time to pick up before. So when they're spending all day at home, they notice things like, my kid keeps forgetting things. I just taught him this yesterday, and he cannot remember this today. What's going on? And then they notice like, oh, he cannot really follow instructions. When I give him multi-step instructions, he doesn't get it. And then it kind of like they piece things together, like, oh yeah, perhaps maybe 2 years ago a teacher mentioned something, and then now it's like, okay, maybe I'm seeing it now as well. And then things like speech and language, I noticed my kid is having difficulty elaborating things. We watched a movie together, and when I asked her, so what was the plot again? What happened with the character? And then she's like, difficulty explaining things, elaborating. And then the parent might think, oh yeah, well, this kind of coincides with her not being able to, teacher said she doesn't speak up in class, or getting her thoughts into words in her essays are difficult, so little things like that. And then parents might come in for a consultation and say, hey, could there be a bigger problem? Is this something we need to look into, or is this just a regular thing that maybe I just need to help her with, just more practice, Yeah.
I agree. A lot of parents come to me with speech delay. So a lot of them are realizing their kids are not talking as how maybe the elder siblings, or how maybe their nephews and nieces speak much earlier. And one of the reasons is because of online classes and online schooling. So would you like to tell us a little bit about how prolonged online classes, increased gadget usage has affected learning ability in some way?
Well, even before this pandemic, we were always talking about limiting the usage of gadgets. But for the past 1.5 years, it seems like our kids are just stuck in front of the PC, for classes about, minimum 3 hours a day, right? For kids who are in, say, international school, perhaps it's more like 3 to 6 hours a day. And then after school, they've got their own leisure time. They're like, playing games or, anything like that, right? So it's a lot of screen time, be it on their tablets, on TV. So it's a lot, right? And of course, when we talk about having things in moderation is one thing, but when we talk about prolonged use like this, definitely there's an impact. Just think about it. When a kid is playing a game on a computer or a tablet, there's so much of feedback. They're getting so much of feedback. There's sounds, there's colors, there's light, lots of things, right? So there's visuals and everything. And then mom says, okay, enough, go read a book. Go do a puzzle. And the kid is like, what? That's like the most boring thing ever, because it's not the same, right? So kids, this generation, they don't know how to do the simple things kind of thing, because they're so used to getting so much, right? So that's one thing. And then on top of that, when you're spending so much time on the screen, especially like passively playing games, that just means less interaction with the people around you. So your communication skills. So again, I'm talking about older kids, but what more younger kids, 2, 3 years old, they're all watching nursery rhymes, this, that. And that just means not interacting with parents, not interacting, not showing, not telling, right? So that social skills as well. There's so many kids who have friends online through their games only, but in their classroom, who's your friend in school? But they have friends online only. So they kind of, not to say lose the skills to make friends, but they don't really they're not practicing those skills, because they're just looking forward to going home and gaming and things like that. So it's a fine line. And I suppose as parents, we need to kind of try and balance that.
Yeah, yeah, I agree with you in the sense that when you do a lot of online stuff, you forget how it is to interact with real people. Like when you speak to someone in real life, you go like, hey, hi, I'm Rakhee, how are you? But when you're on a computer, it's automatically, are you in game one or game two? Are you going to be this person or that person? Am I this role or that role? So there's no interaction, physical interaction. A lot of parents are worried because there's no peer interaction. There's no socialization. Like you said, everybody's got friends online, got 2,000 Facebook friends, but when you actually go out, there's maybe 2 people that you can hang out with. So there's a lot of issues in that sense. And one of the things that I realized in the younger age is speech delay. So below 2 years old, I've even got a 3-year-old who didn't say a word, no words at all. And when I ask the parents, both are working from home and the child is on an iPad the whole day. So from young itself, iPad to eat, iPad to I mean, that's it. Basically, it's iPad. And so I just told the parents, it's cold turkey. You've got to just remove that iPad totally, and I'm going to give you 3 months to interact with your child. And within 3 months, he started talking. So there's a lot about, it's basically a lot of reduced connection between parents and children. When there's online games involved, and there's online teaching, and even the teachers, you've got 30 faces there all over. How are they going to interact with one child, And then you've got some kids screaming in the background, teacher, I want to go to the toilet. I've got some kids screaming, teacher, I want to eat my lunch now, So it's utter chaos online. So I can't, there's just so much going on in that child's life, So what are the red flags you think that we should actually be looking at in terms of development? Like we know that, okay, so now you've got prolonged lockdowns. We know that there's issues with prolonged online stuff and all that. So what are the red flags that you think that if a parent sees something like this, I should be a little bit alert and I should seek medical attention, or I should seek some psychology to review? What are those red flags?
Well, it depends on the age. At different stages, we're looking out for different things, right? So, for example, say at 18 months, right? If a toddler isn't pointing yet, there's no joint attention. If mommy looks one side, the toddler isn't following the mom's gaze. Say poor eye contact, not walking yet, still toddling about, right? Not imitating, used to have skills that now they've once already lost, right? So these are little things at that age. And then, but when you talk about a 3-year-old, maybe you're looking for things like no words yet, drooling a lot, and then perhaps things like not speaking in sentences, short sentences. At 3 years old, you should be able to do that already, right? And then not understanding instructions, so things like this. We would definitely, but the thing is, you see, we have to remember that some parents don't know, what am I looking out for? Like, what is, especially parents who perhaps don't have another child to compare with. Yes, we know we don't want to compare, but if they don't have that, they find it quite difficult, and that's where I feel these milestones, these checklists, right? This developmental milestones checklist are very helpful. So there are reputable organizations like CDC, Pathways, that have free checklists online, for each age group, right? So I have parents who have, who know, and they've checked and they've come because they've seen, and they're like, hey, I did this. I don't know whether it's proper or not, but looks like my child isn't doing this, and this. Should I be worried? Right? So that's why I think creating awareness about these things so parents know where to look and at least start looking first and then seeking help. Right?
Yeah.
I think that's really important. Yeah.
In a local perspective, it's also in the birth book. So every child that is born, they get that little blue book, pink book. It's also in there. There's a lot of things in the book. Sometimes it's just information overload, but just flip through some of the pages. And every state where you're supposed to see the doctor, 2 months, 3 months, 4 months, there's actually a list for you, a checklist for you to actually tick and see whether your child is developing according to that. So the first page is actually what parents are supposed to tick. Then the next page is what doctors take and find out if there's any issues. So have a look at those books and see if there are any issues. So some of the red flags, like what Dr. Dhanya has mentioned, it's not something that is easily picked up. So a lot of times parents pick these up a little bit late, but it's never too late to seek medical attention. So if you feel your child is 4 years old and not talking, or if you see your child is 2 years old and not walking, these are signs that something is wrong. So see your doctor and we can do the further assessment. And at 2 years old, I think every child will get an MChat, which is basically a screening tool that we use to look for autism. A lot of parents are worried that their child's autistic. I mean, statistics by CDC reports that 1 in 60 children are autistic. So it's actually quite common. It's just that it's a spectrum, So whether your child falls into which aspect of it, it's always good to go back to your developmental milestones and have a checklist. So what do parents do, Dr. Dhanya, if they find something is amiss, at 2 years old something is wrong, at 3 years old something is wrong? What should these parents do? Where should they seek help or support?
Yeah, so I mean, for one, I've met many families and parents who picked up something, but they think, nothing much. He's a boy. He will speak a bit later. Daddy also spoke a bit late. Just give him some time. So sometimes I see kids at 5, but when we take their history, we find out that they noticed difficulties when the kid was 1.5, 2. But they didn't do anything. They just waited for him to develop on his own. But I mean, imagine if they had sought treatment at that age, and he would be in a much better place. So I feel this stigma associated with getting a child, a toddler, help needs to go away, right? We need to create awareness in that area as well. But yeah, so where do they go first? So obviously the first spot would be the pediatrician, right? And sometimes the pediatrician would then refer out, right? Yeah, so referring out would be typically to a developmental pediatrician. But we have not many of them here in Malaysia, and their waiting list is very long. So often, some pediatricians also do similar kind of developmental assessment type things, and clinical psychologists as well, right? So often we work together as a team, and I feel that's really, really important. Instead of waiting, oh no, the right doctor for me to see, I'll only wait for that doctor and wait 2 years. That's really not necessary. There are other people who can help you, and you're missing that golden period for your child to absorb and learn and progress if you're going to wait. So getting some therapy while waiting for a particular appointment is still going to be helpful. You're going to jumpstart your child's progress, but just get the correct guidance lah. So seeing a pediatrician, a developmental pediatrician, a clinical psychologist would be the place to start.
And when you see the pediatrician, I think we as a whole, I always call myself like the manager. So I will be the one that will refer you to every different. So the general pediatrician will refer you to the clinical psychologist, will refer you to the developmental pediatrician, will refer you to occupational therapy or speech therapy or an audiologist or whichever small aspect that you may need. So like you correctly said, there are very few pediatric developmental specialists in the country, and their waiting list can go up to 2 to 2.5 years. So make the appointment. And we're not saying don't make the appointment. Get the appointment, but at the same time, get an appointment with a clinical psychologist, get an appointment with the pediatrician, get an appointment with an audiologist. Just make sure their hearing is normal. Something as simple as maybe a little bit of hearing it could impact a whole aspect of your development. I mean, imagine if a child couldn't hear certain, they say, oh, but he can hear me when I talk with. Yes, but sometimes they have what we call high frequency or low frequency hearing, where if you say, come here now, all they hear is now, because they've got different frequencies where they can hear you. So getting a formal audiology or hearing assessment done is, I think, very important. If you have a child that is looking in a certain way, getting a simple eye check is also very important. So ruling out all these small things and making sure all the other aspects are optimum is always important, and I always refer my patients to a clinical psychologist by telling them that you can do the exact same thing. You can give them a formal report and things like that, but the follow-up will be with a developmental pediatrician as well, so at least you've got a diagnosis, you've got something that you can work by, and sometimes it's just what we call, maybe it's just a false alarm. Actually, your child's normal, and everything is all fine. You go and see a clinical psychologist, a diagnosis of someone that's normal is made, and you just follow up with that person, and everything is fine and dandy in a couple of years. like we said, our boys generally talk a bit slower and all that. So after a while, everything is normal back again. But the important thing to remember here is early assessment, early treatment, early intervention. So thank you so much, Dr. Dhanya. This has been a lot of information in a short period, and I wanted it to be short and quick. And I just want to touch a little bit before we go about mental health in children. Are there any tips? We know that there's a lot of issues going on now. There's a lot of confusion because school is starting on September 1st. You know, we don't know what's happening. I mean, everybody's got their own agenda in terms of what's happening with the government today. But we've been announced that, it's been announced that September 1st school is starting. And a lot of parents are anxious. A lot of parents are in that limbo of, should I send my kid to school and risk the exposure of them being exposed to COVID-19? Should I keep them at home at the risk of them having mental health issues, or myself having mental health issues? You know, so maybe would you like to be able to give us some tips on how to take care of our children's mental health during this time?
Okay. Yeah, definitely. It's even for adults, it's a crazy time. So you can only imagine what the kids are going through. You know, 1 month school open, next month school shut. Next month school open, you know, I just joined back my swimming class, and then, oh, sorry, cannot anymore. You can't go again. You know, it's up and down, and now they've been homebound for a really long time. Initially, when this first started last year, March, kids were all really excited. Oh, yay, no need to go to school. Yes, awesome, fun. You know, I can just roll out of bed and switch on the screen. Yeah, but after a while, it's like, I see so many kids who are struggling. You know, attention is a big issue, and parents working at home, then managing their kids at home, trying to help them with their work. It's very difficult. And so one thing I feel is really important is for parents to keep this open line of communication with their kids. Age appropriate, you know, for the younger ones and for the older ones as well. Just to let them know that, just to talk to them about their feelings, you know, what's going on, what's on your mind, you know, because I've had kids tell me things like, I'm waiting to go back to kindy, and I'm waiting to go back to school and touch my friends, you know. So like, because I cannot high five, I cannot hug my teacher, and these were all really normal things that they used to do, right? And now it's like, wear this, wear your mask, wear your shield, you know, don't touch, just, you know, just wave from afar. So all these things are, you know, little things that maybe we are getting used to, but for the little ones, it's not, right? So talk to them about what's going on, about it's okay to feel angry, it's okay to feel worried, you know. So that's really important. And then on top of that, also, children thrive on routine. So as much as possible, try to keep things stable, you know, because there are other things around their life is, you know, we have no control over it, right? So what's happening at home, if possible, try to maintain lah, you know. So like, say, bedtimes, meal times, and then to do fun things with your kids once in a while. And that's what I've heard from parents a lot lately. You know, it's very difficult because I'm so stressed. I don't have time for fun. You know, I'm not as productive as if I was working at my office. So I don't have the time to commit to my kids and play and all this. And now you're telling me to do campfire night with them, do board game night with them. You know, it's just ideas. But how else? How else are you going to connect with your kid at this stage? Because they have nobody else. You know, their friends are not there with them also, right? So, and then when we talked about technology earlier, saying how too much of that, but try to use it in a positive way, you know. So like when we talk about just watching cartoons or YouTube or just movies, it's very passive. So if you want to use it actively, in a creative way, so maybe, you know, things like coding, designing a game, art, something where there's some sort of input from the child, you know, it's not just blankly watching, you know. And then on top of that, if you want to have some sort of communication with their friends, you know, arrange lah, you know, like Zoom night with their close friends. It can be a dress-up party, a pajama party, a pizza party. Everybody eat pizza at their own place, play a game, whatever. And then use things like Google Docs, and they can do it. I have no kids who have done like a group artwork together, you know, or write a story. Like I do the start of the story, you complete the second paragraph, then the next person. So there's some sort of connection, you know, rather than everything. Because like you said, when you're in a Zoom class, you're seeing your friends, but there's no real interaction. You just see their face and they're all muted. you know, the only person you really listen to is your teacher, right? So, you know, to keep things as normal can be, you know, given our circumstances. And I feel one of the most important things is for parents, in looking after their kids' mental health, is actually looking after themselves. Because I think that's what a lot of parents are. I mean, again, everybody's stressed, everybody's trying, but if we are not okay, our kids can pick up on it. You know, the anxiety, the stress, and it comes out at home. I mean, we all have experienced it. You might tend to shout at the kids, take it out on the kids, even if it's just an innocent question, right? So again, it's easy to say time out, take some time out for yourself. There might not be much time, but if possible, you know, just you need to have a clear headspace in order to be able to look after your kids' overall well-being, right? So put yourself first also lah, basically is what I'm saying, you know. Yeah.
I love that. I love your ending because I think it's very important for you to fill. I have this thing called the love bucket. So if you have your love bucket that much, how are you going to give it to your kids? But you've got to fill your love bucket so that you're able to share it with your children, with your husband, with your parents, with your patients, with whoever, your workers, your employees, and everything like that. So if you have your shit bucket, excuse my French, but if you have your shit bucket that's full, you're just going to shout at everybody. You're going to take out everything on the whole world. And you really need to take a step back and realize that the problem is not them. The problem is you. You're not giving yourself enough time. You're not giving yourself. I guess you're not giving you yourself. You know. So self-care is very important. And I agree with you that parents at this point, I'm so sorry, but you decide to become a parent, you have to sacrifice a little bit. That take that little bit, even though it's half an hour a day. Half an hour in the morning, half an hour in the evening. Unstigmatize emotional feelings. Get your child to recognize emotions. Tell them it's okay to cry. Tell them it's okay to tell you if something is wrong. Talk to them. Have a connection. Even if it's that 10, 15 minutes during a meal. Like I always try to get a meal, at least one meal a day with the kids, you know, whether it's breakfast, lunch, or dinner. During that meal, try to interact with each other, put down your phones, you know. I think what you said is absolutely right. We as parents have got to, you know, first of all, fill up our bucket of love and then give that love off in terms of connection, in terms of emotion. So much that we can do, but it's just not easy to do because everybody is stressed and we all just got to do what we can with whatever capacity we can.
And what you said, putting down the phone, that's something we are all guilty of. You know, we tell our kids to put it away, and you know, we say these things, but yeah, we need to learn to put it away as well. So
children parent us. So, hey, mom, you're still on the phone, but you said this is no gadget time. Okay, I'm sorry. I'm on call. I got a call from the hospital. You know, so we are all guilty. It's been so good. To everybody who just joined us, we spoke a lot about child development. What is normal child development? We spoke a little bit about red flags and how to pick up things and what has actually been happening with children in the past lockdown, multiple lockdowns and during this pandemic. What are the issues that have arisen from online classes, prolonged gadget usage, prolonged online usage? So we spoke about all these things as well as we spoke about how to reach out, who to go to, and where to get the support necessary. So if you've missed any of this, this recording will be saved on my IGTV as well as on my YouTube channel. So feel free to go and have a look at it again. You can always watch it again and see the aspects that Dr. Dhanya mentioned as well. And I'd just like to say thank you so much to Dr. Dhanya for taking the time out to talk to us today. It's not easy getting a hold of her. Trust me, I've referred a few patients. It's not easy getting a hold of Dr. Dhanya. So thank you so much. It has been a pleasure. I hope to see you physically soon. Take care.
Well, thank you.
Bye.
Bye.